I'm Dr. Naveen Somia. I'm a plastic surgeon based in Sydney, and this weekend I've been in Melbourne attending a conference about eyelid and facial cosmetic surgery. The prevalent question this weekend has been, is eyelid surgery predominantly functional or is it cosmetic? So I feel that I should shed some light on that important topic. So in summary, eyelid dysfunction is a natural process of aging. But the impact of eyelid dysfunction is quite significant, that in the over 65s, it is a big fall risk. In other words, if you have visual impairment due to eyelid dysfunction, you put yourself at a higher risk of falls in the over 65s. In the under 65s, it impacts productivity, because nowadays a lot of productivity is based on computers and light-based devices, so your interaction with those is limited if you have some degree of eyelid dysfunction. Very commonly, my patients come and say that my eyesight is getting worse, but I went to my optometrist and he or she could not find anything wrong with it. We tend to discount the role the eyelid plays in impacting your vision, visual fields, and hence your interaction with your daily environment. Over the last few years, we've found an explosion in light-based devices, namely tablets and computers, and as a result, Australians have been quoted as spending more time on devices more than sleeping. And that has impacted, put a lot of strain on the eyes. And there's a documented condition called computer vision syndrome, that if you spend more than 3 hours a day in front of a computer, you have some symptoms. The eyelid has to keep open for such a long period of time, and that ultimately puts a lot of strain on your muscle to keep it open. Over time, it will stretch. So there is no question that eyelid dysfunction is predominantly a functional impairment due to the degenerative process that we see with aging. And as a result, trying to rectify that structurally will result in a better functional outcome and a collateral benefit of looking good. The looking good aspect, improving appearance, is not the primary, but it is a secondary benefit. It is the same as, say, if you have an amputated fingertip and we put it back, yes, you restore normalcy, you restore proportion, and hence aesthetics. But that is not the primary reason why a fingertip that has been amputated has been put back. It's mainly for the function, but the secondary benefit is to improve the appearance. So needless to say, anything that has been distorted by either trauma, accidents, cancer, or the degenerative process of aging, if you restore things back to its normal anatomy, it is seen as a perceptible difference and hence a visual improvement in the aesthetics. So that does not make it a cosmetic procedure. A facelift is a cosmetic procedure. Yes, there is a significant improvement in the appearance. The functional improvement is debatable, but compare that to an eyelid operation where the functional impairment is critical. So that is kind of why I believe that an eyelid is a functional operation, and its impact on the vision, and hence the impact of decreased vision on productivity, risk of falls, risk of accidents, is still not very well documented and understood. Right now, the Medicare schedule looks at eyelid surgery as a medical procedure with the typical, if it has an impact on your vision, then there is some degree of cover for the procedure. The health funds that subscribe to this theory do offer varying degrees of support based on your plan. So as we speak, there is some degree of support with Medicare and the private health funds if you want to undergo eyelid surgery, if the eyelid surgery is causing some disturbance in the vision, if you've got a droopy eyelid causing ptosis, or a eyelid that is overhanging so much that it is affecting your visual fields. Over the last 9 years, a lot of my practice has been focused around eyelids and periorbital rejuvenation involving the area around your eyelid. So bulk of my practice is that, and I'm very happy to see you if you wish to come and consult with me. Very frequently, if you're far away from Sydney, we usually request you send us some photographs, and I can have an opinion emailed to you or facilitated that way, so that you don't have to travel all the way to Sydney to see me. And if we think it is a reasonable outcome, reasonable to have eyelid surgery, then it is mandatory that you come and see me for a consultation. Thank you.